So we have a case today where we're taking out tooth number 10, doing an immediate implant with some bone grafting and the placement of a membrane. Apical to that restoration is external root resorption. And then as we look over here, we've got a bone graft, pretty much a 50-50 cordocancellous graft mixed with growth factor along with a PRF mixture. And then we're also putting in the Alligide GF. And right here is a good way to see this, that little slice in the membrane should be in the upper right corner. When we apply that, that means that we've got the proper sides being placed towards the bone graft and towards the mouth. So we'll show you that in just a few minutes. Number 10 has been removed. We have a slight apical perforation right here. So what we're going to do is place the Alligide GF over that and a portion of it over the actual extraction site. On number 10. So right there, you get to see it. Then we get part of it to come out down there. Now we're going to get the implant placed. Hold still, get this right. Yeah, you don't have to touch it. Beautiful. So we're using a 3.3 by 10, or I'm sorry, it's a 3.3 by 12. Get that transfer mount on for now over the little perf. Okay. Like so, we've got our implant in. Can you see on it real good? Mm-hmm. Okay, we're going to let that be for a second till I get the Alligide GF. Okay? So now we're going to open the Alligide GF, grab the sterile pack on the side. We're using a 10 by 10. And what we're going to do is place this over that slight perforation right there. So I usually clean pair of scissors, just trim right next to it. Come on, come on. There we go. Now I'm going to lay it on my finger so you can see that little slice. This means now the shiny side above, that is what, I'm sorry, the shiny side is what faces the environment, okay, or the flap, the chromion side, which is the rough side, placed. And we're going to gently get that down into the environment, and we're going to let it hydrate. I'm just trying to get it so it sticks. If you need to, you can touch it like that. To just get it so it begins to saturate, hypersaturate with the patient's own heme. Slowly, 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 it's saturating, saturating, saturating. Now it becomes much easier to use, a little more pliable. We're painting it kind of over the actual graft. And now we're going to take the flap and reapproximate. That's it. That's how you place that little guy. Yeah. So now what we've done is we've placed the membrane below. We filled in the above voids, put the healing cap on the implant. I'm just finishing up with any tiny voids. Touch it again. And then we'll put an additional PRF over the top of this and close up, and I'll show you a picture of the sutures. We're using a 5.0 chromic. So we've closed the reflection, we've gotten the vertical closed, and what we're doing is just putting in a PRF little membrane under the exposed socket area so that we can hopefully coach some more epithelium into the area. So there was bone graft, the healing cap was placed, bone graft sealed and compressed over top of it, and I'll show you when I finish covering this up. Primary closure, all except for the socket where we use some PRF with that. The vertical's closed, all 5.0 chromic. I'll give you a different view. and the graft was used to repair that labial bone perforation at the apex, and the GF was